All right. All right. Thank you for joining. Here we go. So, this time we are talking about neck pain and back pain. What to do when you have been injured. Um, let's say you wake up and you have a crook in your neck. Okay. That happened to me the other day. It's just hurting. Just when I turn this way, it hurt real bad. Or let's say you did something at work and you or at home and you hurt your back, you sprained your back, or a car accident or work accident, you name it, it happens to us. So what do we do? How do we handle that? So the first thing to remember is it's important to take a break and rest. If you can try to take it, it depends on how bad the pain is. If the pain is really bad and you know that it's going to be difficult to function for that day, consider taking a day off or at least half a day off. Okay. Um, so rest is critical. The other thing that's important is um, also it depends on your body and what your body responds to. If your neck is spasming, if your back muscles are spasming, and you're getting real tight muscles or real strong, kind of like Charlie horse type of pain, you may consider breaking that um, with an ice pack, cold pack, and sometimes that helps tremendously. And just relax, take some deep and very slow breaths, 3 or 4 of them in a row, okay? Taking those deep, slow breaths and just getting in a position where you're completely relaxed, okay? And this will actually help relax and break the muscle spasm. So you could take ice, crush ice, and massage it into the muscle. That's one way. Cold pack, or you could do heat, moist heat, which is my favorite. So you can take hot bath or which is preferable or a hot shower because when you're in the bath you can actually lay down and rest and relax your muscles, whereas when you're in the shower your neck muscles are having to keep your neck and your head up. So there's still a number of the muscles are still firing off even while you're standing or sitting taking a hot shower. So a hot bath would be ideal. Epsom salt in the bath would even be better. Epsom salt is a mineral salt and it has magnesium sulfate, and it's very, very good for relaxing muscles and helping get rid of inflammation. Okay, so that's one option. Um, Another is to take a rice sock. Okay, you could take a clean sock and put rice in it, uncooked rice, tie it up, and then put it in the microwave. You can make it as big as you want or small as you want. And if you have essential oils, you could put a little like lavender essential oil, and that is nice. And just, put it where it hurts and relax. Again, relaxation is key. Turning off the muscles and relaxing as much as you can is very, very important. And then after you've been able to relax for at least a few minutes, depending on how bad the injury is, how bad the pain is, finding the position of maximum comfort, propping your pillows up just right so that you're comfortable. Sometimes for back injuries, getting into like a fetal position, bending over, laying down. Some people can lay kind of like get on their knees on their bed or on the floor or what have you with a big huge pillow and just lean over that. Okay, so that kind of curving the back and leaning forward motion is very, very good for back pain. It usually helps quite a bit. Okay, so in doing that, that right there in and of itself, if you do that for a long enough time, can actually really reverse the strain pattern right then and there. Okay, especially with deep, slow breaths. Other things you can take a lot of thought into what you eat. Try not to eat a lot of sugary foods. Try to drink a lot of fluids. Fresh fruit. Fresh fruit is just absolutely amazing what fresh fruit can do because it has electrolytes and potassium and other minerals that are very, very, very critical and important to restoring the pH balance in the body and getting rid of the lactic acidosis and things like that. This is also particularly helpful to do after you've had a massage or after you've worked out. Just a lot of fresh fruit, water, smoothies, things like that. Just go real salads. Salads have a lot of water and a lot of healthy electrolytes that your body needs. Or you could get Gatorade and water, okay, Pedialyte. These are all electrolytes. You can get the little electrolyte packets that you can buy. One of them is called ORS, oral rehydration solution. Open it up, put it in a water bottle, and drink it. The different things you can do. But this is very, very important for like recovering the muscles. Um, Okay. Oh, another one. I almost forgot about this. Peanut oil. Taking some peanut oil, massaging it directly into the area that hurts. It's a powerful anti-inflammatory. It's very natural. You can buy it at the grocery store in the oil section, and then just massage it right where it hurts, or in the back, wherever. Your joints, your hands, your knees, wherever you have pain. Peanut oil is wonderful for arthritis and for pain. Um, Okay, so another word about peanut oil is similar to taking an ibuprofen, which is Advil, uh, or let's see, ibuprofen, Advil, Aleve is naproxen, which is similar. These things are good for inflammation. They help a lot, but you have to be extremely careful with ibuprofen. You have to take that with food. Otherwise, you can end up with a stomach ache or an ulcer. I mean, you have to be very careful. Taking that with food is important. Um, Also, you need to be drinking a lot of water because it can make the blood pressure shoot up. It can also make it can cause a kidney problem if you're taking too high doses too often without enough water. Water is cleansing to the kidney, and so it will help prevent a kidney problem. So that's the only thing with ibuprofen. I like topicals. There's one that's real popular that we prescribe a lot. It's called Voltaren gel or diclofenac. I'll put it in the chat. Voltaren gel is um, is also like a topical anti-inflammatory, similar to ibuprofen, Advil, Motrin, stuff like that. Um, Peanut oil is similar to that, and you just massage it right into the joint. It's odorless, whereas peanuts smells like peanuts. It's a strong peanut smell. So anyway, that's a prescription. It might even be over the counter. I'm not sure, but anyway, that's also very good. You want to do that one 3 or 4 times a day. Um, okay, so by, dealing with repositioning your body, okay, resting, doing the fluids and drinking. Oh, blueberries. Blueberries is wonderful for pain. It helps with pain, helps with weight loss, help with memory. Blueberry is a wonderful thing to do to help you when you're going through that. Salmon is good. And anything with omega-3, olive oil, things like that. These are all very good for pain. Okay, so some of the foods that we eat actually helps get rid of pain, and some of the foods that we eat promotes and makes pain worse. Like I said, processed foods and sugars. Watch out for that. Try to stay away from that when you are trying to recover. Okay, so now what to do if none of that works? You're still having quite a bit of pain, you can certainly go to urgent care, make an appointment with your doctor, make sure everything is okay. They could do x-ray, or sometimes they have to even do an MRI. Usually they do an MRI after it's still hurting. After you do these things first and it's still hurting a lot, then they do an MRI. Certain conditions which are very rare, certain injuries, when they're severe enough, of course, they move quicker and faster, and sometimes even need surgery right away. So it just kind of depends on the severity and what's going on. Typically, if you have a neck injury and you're having shooting pain on one side down into the arm or hand, it may be a disc problem, pinching on the disc. I mean, on the nerve, on the spinal cord, and so these would be a little bit more urgent situations. Same thing with the back. If you have a pain that's really severe and is shooting down one side or on both sides of the legs into the foot, again, this could be more serious. Sometimes the back injuries are so bad that you can't walk, uh, or you're having a problem with using a bathroom on yourself suddenly. Again, these are a little bit more urgent and emergent type of situations. Go ahead and go to the emergency room, tell them what you're going through, your symptoms, so that you could get some real help quickly. Okay. Some of the things that a doctor's office may do is give you an injection in one of the muscles. So in the deltoids or in the buttock, usually they'll give an injection like a steroid injection. And the steroid injections are very helpful. It helps with pain all over the body, pain and inflammation over the entire body. So these are helpful. You could have a reaction to it. So typically when they give that, we want to make sure that we watch you if you haven't had those injections before for a little while. Make sure you don't have an allergic reaction to it. Most people do very well. If you have diabetes, if you have sugar problems, steroids can definitely raise the sugars. So we're cautious with steroids. Okay, let's see here. I think the other thing is stretches. So stretching is also very key. The key to stretching is to stretch after you're warmed up. So after you've been walking or exercising, then you could do a deep stretch. After a hot bath or shower or applying heating pad, then you do a deep stretch. So a deep stretch would be simple, s- stretching to one side, down to the other side, back, and then twisting to one side and then or rotating to the other side like that. These deep stretches should be slow. I demonstrated and I went pretty fast. You want to do them very slow, taking deep, slow breaths, about 2 deep breaths per stretch. Um, would be good. And then you can actually feel the muscle. Sometimes it will just give, and all of a sudden your head would just drop like more. And that is because the muscle just relaxed. And so we call that a release. You just had a release in the muscle. And that's therapeutic stretching when you get to that point where you actually take enough time to really feel that stretch point, it feels good. It feels really good. Okay, so stretching is good. Um, Taking time to stretch your back out, touching your toes while your knees are, straight. You could do that sitting up and touching your toes, standing up, reaching over, touching your toes, or trying to, just kind of hanging over like that. Open up your legs, lean over, and really stretch, stretch, stretch. These things. Another thing is just simply stand up, put your arms straight in the air, and take a deep breath. Put your arms out, stretching, put your head back, going up on your tippy toes, taking deep breaths when you do that. That feels good. It really does. It opens you up. It helps with balance. There's some wonderful balancing exercise. I think one of these days we're gonna do a video with just demonstrating some really good stretches, but do what feels good to you. When you stretch your body out, forward bending at the hips, backward bending side to side. So just like we did with the neck, do that with your hips joint. So you're bending over at the hips, bending backwards to the side, to the other side, and then rotating. So those things are excellent, and it feels so good. Another thing, if you have access to the sun, go out in the sunlight and let the sun hit your neck or your back. Oh my goodness, it's just warm. It feels good. Vitamin D, make sure you're on top of your vitamin D as well. Take vitamin D supplements. This will also help your pain. And when in doubt, You could call the nurse advice line if you have insurance. You could go to your local urgent care, community health center, your local uh, emergency room if it's really bad. When in doubt, go ahead and get yourself a professional uh, consultation by a doctor or a physician assistant, nurse practitioner. Get checked out. Chiropractor, even chiropractors are wonderful when you're dealing with pain. Okay, same thing. Physical therapy. Typically, physical therapy we reserve for um, a little bit more long-term pain, like if you had bad work injury or repetitive work injury or a car accident or, long-term chronic pain been going on for a long time, physical therapy is wonderful for that. Okay, I think that's it for now. Thank you for joining. I have made some other videos in the past under the live section if you want to look that up. There's some more on just pain, on how to manage chronic pain when you have pain for a long period of time, years, months. There's other videos on that. This was specifically for neck and back pain. Okay, I'm out. Be blessed. Have a great day. Love you to life.